What are some natural, non-medicated approaches to mental health?
Well, there's a whole bunch of different things that you can say about people that are totally mentally healthy.
Okay.
For one thing, they're engaged in community. They have healthy community. They've got people in their family or their church or their neighborhood or organizations that are like-minded and are not unhealthy. They're nurturing. They're compassionate. They help one another. They rescue you and you rescue them. So if you have that, you're lucky, because that's
Very lucky.
not hard. That's hard to get. They have meaningful work. You know, people with jobs that are meaningful. They don't hate their work. They're doing something that's good for society. They feel it's a fulfilling work. You know, that makes you mentally healthy. If you hate your job, you know, you're angry and you want to go to the bar then or something.
You do, yes.
They exercise regularly. Good exercise.
Now that's the elixir, isn't it?
Yeah, that's one of the best things for depression that there is exercise, regular exercise. That and fish oil. Those are the two that beat all the drugs hands down and don't have any side effects. Although I guess you can get addicted to running, probably. There are
they say,
running
yes.
addicts, I guess.
But you won't get addicted to fish oil.
Fish oil. No, right. And then, of course, all these other nutrients that haven't even been assessed in comparison, like say 5-HTP. They haven't really done a study comparing that and other modalities, but I guess that's probably one of the best antidepressants there is. But they also have balanced lives. This mythical person that doesn't have a mental illness, so-called mental illness, they have balanced lives. They have fun. They enjoy art, or music, or poetry, or they pray, or and do meditation, or yoga, or body work. Those are all mentally healthy things too. They have some spiritual depth. You know, believe in a higher power, perhaps, or.
So you don't hear about the Buddhist monks who meditate for several hours a day, being crazy and being on antidepressants.
That's right. Yeah. All these things are things that you can avoid drugs or any. You can avoid the desire to self-medicate your mental anguish if you're not having any mental anguish. The most healthy people I know, physically, mentally healthy people I know, are anti-war protesters. They're out there, you know, with other people protesting injustice, or working for justice or peace or anti-racism or something, you know, a cause, yeah. And they don't even think that they need to have a drink, or they need to take a drug, or whatever. And then, of course, if they have had healthy child rearing, if they've been in a non-punitive family that nurtures them, and you are obedient because you have mutual love and care rather than the fear of a beating. You're obedient because you're going to be afraid of getting beat. That's a different picture entirely than someone who's, I want to please my dad because I love him so much, and he loves me. So, and there's probably a whole bunch of other things like that. But if we are living lives of fulfillment, you know, we're not needing self-medication. We're feeling good about our lives. Unfortunately, it's a rarity for somebody to have all of those, you know, but we can at least strive to have some of them, and we can kind of that. And so, in my psychotherapy, I mean, I educate every one of my patients about what are the alternatives to drugs, and we talk about that. And of course, we've already talked about nutrition, and brain nutrients are vital. You can be the healthiest person alive, but if you're eating lousy food and you're poisoning your brain because of toxic substances in the food supply, you're not going to be at that optimal level of mental health or physical health. So there's a lot of things to do that we should try first before drugs. Right?
Thank you, Dr. Coles.
Yeah, you're welcome.